Back, Ms. Ross.
Thank you, Mr. Chairman, and thanks to all the witnesses for testifying today. We're here today to discuss one of the greatest threats to women and families that our country has seen in 50 years. If it holds, the Supreme Court's draft opinion overruling Roe will effectively allow states to ban abortion entirely. Denial of necessary care, including abortion, can have profound and lasting impacts on people's lives. Denial of access to abortion will be particularly harmful to women who already face disparate access to all sorts of kinds of care, including people of color, people with disabilities, people in rural areas in my state of North Carolina, and low-income people. In states like mine, we have not expanded Medicaid for more than 500,000 people. We already see significant disparities in who can access care and corresponding disparities in health outcomes. Women who fall into the Medicaid gap in non-expansion states like North Carolina are frequently unable to access contraception, unable to get prenatal care, and delayed in accessing care during their pregnancies. Many of these same states are also likely to enact severe abortion restrictions if Roe is overturned. We know that forced pregnancy hurts women, threatens our physical and mental health, and restricts our economic possibilities. However, the Republicans on this committee have shown that they don't really care about these realities or these women. I hope that they demonstrate greater capacity for understanding when they realize that this decision will have ripple effects that harm families and children by locking people into poverty and further limiting access to health care. My first question is for Professor Goodwin. Please explain how low-income and people of color will be prosecuted disproportionately and face greater legal risks for violating anti-abortion laws compared to those who are white and wealthy.
Well, individuals who have greater means will be able to afford childcare, afford to be able to travel out of state, be able to have a hotel out of state, the ability to be able to get healthcare services and abortion care out of state. For individuals who happen to be poor and people of color, they are already subject to disproportionate police surveillance and surveillance by other people in society. This will only be inflamed to an even greater extent, and when abortion access is not available in their states, that will result in high rates of maternal mortality, which we already see, and also maternal morbidity. And these are people who stand the risk of being reported by medical professionals who are pressured right now to report on their patients who have miscarriages and stillbirth. That is already occurring in the United States, given this anti-abortion backdrop.
And Dr. Robinson, I saw you nodding when I talked about not having Medicaid expansion, and I know that you practice medicine in a state that has not expanded Medicaid. Could you tell us what that failure has done to the health of women who are either seeking to have a child or may not be ready to have a child?
Thank you. Yes, I too live in a state that did not accept Medicaid expansion. And so as I said in my testimony, that in Alabama, that the maternal mortality rate is 5 times more than our white counterpart, and that's higher than the national average. And I think this directly corresponds to access to quality health care. And so with that, without taking Medicaid expansion, then my people are being harmed by this.
And do you see a hypocrisy between people who would deny access to abortion care at the same time they're denying access to health care?
Absolutely.
Thank you, Mr. Chairman, and I yield back.
Gentlelady yields back.
Mr. Chairman, briefly, could we allow Ms. Glenn Foster to reply briefly to the very personal comments Ms. Dean
Gentlelady